You reach for it the same way you always do. The label is familiar. The shape of the bottle is familiar. You have been buying it for years, from the same pharmacy, sometimes the same shelf. It sits in the cabinet between your multivitamin and the prescription bottles your doctor ordered. You shake 2 capsules into your palm. You swallow them with water. You do this because somewhere along the way, a friend mentioned it, a television segment covered it, an article online called it one of the best things an adult over 60 could do for their heart. So you added it, quietly, carefully, the way a sensible person adds something good to their routine. Close-up of hands placing supplement bottle back on bathroom shelf, prescription pill organizer visible beside it. You take your cholesterol medication in the morning. You take this supplement because you want to protect your heart from every angle you can. Here is what most people have never been told. Taking a supplement to support your heart while you are on a cholesterol medication is not reckless. It is not careless. It is the behavior of someone who is paying attention, someone who read the label, did the research, and decided to take their health seriously from more than one direction. There is nothing wrong with that instinct. The instinct is sound. Look, I want to be honest with you. I see this every single week. People come in with a supplement list in their hand. They are proud of it. They built it themselves, and they should be. The problem is not that they are taking supplements. The problem is a conversation that nobody had with them before they started. What you cannot feel, what produces no warning, no obvious symptom in the early stages, is what happens inside your liver when 2 specific compounds meet. That is what this video is about. I want to tell you about a patient I will call Dorothy. Dorothy was 68 years old, a retired church choir director, methodical, the kind of woman who read everything before she agreed to anything. When her doctor prescribed Atorvastatin, Dorothy did not just take it. She went home, researched it, and decided she also wanted to support her body from the inside. She added a supplement, one that her neighbor had recommended, one that every article she found described as beneficial for the heart. For 14 months, Dorothy took both, every day, without fail. Then she began to feel something she described as a deep, persistent ache across her upper legs and lower back, the kind of heaviness that makes you grip the stair railing a little tighter. She mentioned it to her doctor at her annual appointment and was told it was likely her age. We will come back to Dorothy, because what her blood work revealed, when her doctor finally ran the right test, is something every person watching this video deserves to hear before they open their cabinet tonight. A standard appointment with a primary care physician allows 8 to 12 minutes of focused conversation. In that window, your doctor is managing the prescription, updating the record, answering your questions, and, if there is time, reviewing your other medications. Your supplement list? It requires a separate conversation, one that most appointment structures do not make room for. Not because your doctor does not care, because the system that schedules appointments in 10-minute increments does not leave space for it. The prescription for Atorvastatin was the beginning of a conversation. This video is the rest of it. If you looked up Atorvastatin and supplements before watching this, the answer you likely found was CoQ10, coenzyme Q10, the supplement that nearly every statin-related article mentions in the first paragraph. And that recommendation is not wrong. Statins, Atorvastatin included, do reduce the body's production of a compound called CoQ10, which is involved in how your muscle cells generate energy. Adding CoQ10 back in makes sense on paper. And some research does support its use for statin-related muscle symptoms. The Journal of the American College of Cardiology has addressed the intersection of statin therapy and coenzyme supplementation in detail. But here is the limitation. CoQ10 does not address the interaction mechanism I am about to describe. It does not affect the liver pathway responsible for how Atorvastatin is processed, and it does not protect you from what happens when that pathway is blocked. CoQ10 answers one question. It does not answer the one that matters most. The supplement that blocks atorvastatin's processing is something different. And there is a very good chance it is in your cabinet right now. My name is Dr. Tiera Khan, and I work specifically with adults over 60 navigating the intersection of prescription medications, supplements, and the daily habits that affect how well both of them work. Before I continue, and I will say this clearly because it matters, nothing in this video changes your prescription. Atorvastatin is a well-studied, highly effective medication. What I am giving you today is the information that allows it to work the way it was designed to work. Please do not stop or alter your medication without speaking with your prescribing physician first. I am going to cover 5 specific things today. 5 mechanisms that either amplify atorvastatin's side effects or reduce its effectiveness. Starting with a supplement that 40% of seniors are taking right now with no idea of the problem it is creating. Stay with me, because point 3 is the one that surprises people the most. Thing 1. Red yeast rice. You may have seen it marketed as a natural cholesterol solution, a gentler alternative to medication, something you can add alongside your statin to get extra protection. Here is what that marketing does not say. Red yeast rice contains a compound called monocolin K, a natural statin, which works through the same biological pathway as atorvastatin. Taking both simultaneously does not mean you are getting 2 layers of protection. It means you are taking 2 statin-class compounds at the same time, with no dose coordination between them. Think of atorvastatin like a precisely measured current of water running through a pipe. Your doctor set the pressure. Your body adapted to that pressure. Red yeast rice opens a second pipe into the same system, with an unmeasured, unregulated flow. Your liver is now processing more statin-class compound than your prescription label accounts for. The dose your doctor prescribed is no longer the dose your body is receiving. The result, reported in the Annals of Internal Medicine, is a significantly elevated risk of statin myopathy, muscle breakdown, along with the liver strain that comes with uncoordinated statin exposure. Tonight, check every supplement in your cabinet for the words red yeast rice or monocolin K. If you find it, do not stop abruptly. Call your pharmacist today and ask for a full interaction review before your next dose. That is 1. And I want you to stay with me, because the next thing I am going to name is something most people consider completely harmless. Something they have heard is actually good for their heart. Thing 2. Grapefruit, and what it does to the enzyme your liver needs. You may not eat a lot of grapefruit, but you may drink grapefruit juice, or buy a prepared breakfast drink that lists it among the ingredients, or eat Seville orange marmalade on your morning toast. Grapefruit contains compounds, furanocoumarins, that block a liver enzyme called CYP3A4. That enzyme is atorvastatin's exit route. It is the mechanism your liver uses to process the medication and move it out of your bloodstream after it has done its job. Think of CYP3A4 like the exit door through which atorvastatin leaves your body. Grapefruit does not slow that door. It locks it. When the exit is locked, atorvastatin does not leave. It accumulates. The concentration in your blood climbs above what your prescribed dose was designed to produce. Research published in the American Journal of Clinical Pharmacology has documented that a single glass of grapefruit juice can raise atorvastatin blood levels by 30 to 90%, depending on how active your baseline CYP3A4 enzyme is. The symptoms of that accumulation, muscle aches, unusual fatigue, dizziness, a heaviness in the legs, are the same symptoms listed as atorvastatin side effects. Many people experiencing them have been told they are simply sensitive to the medication. In many cases, the cause is a glass of juice. Tonight, remove grapefruit, grapefruit juice, and Seville orange products from your daily routine entirely. Sweet oranges, lemons, and limes do not carry this interaction and are safe. I'm going to pause here because this next one catches people completely off guard. It is the one where I most often see people say, out loud, in the office, "Nobody ever told me that." So I want you to pay attention. Thing 3. High-dose fish oil and its effect on atorvastatin's clearance. Fish oil is one of the most commonly recommended supplements for adults managing cardiovascular health. Omega-3 fatty acids. Cardiologists mention it. Pharmacists stock it prominently. Every senior health article in the last decade has described it as beneficial. And at standard doses, it is. The problem emerges at high doses, specifically above 2 to 3 grams of combined EPA and DHA daily. At that level, research published in the Journal of Clinical Pharmacology shows that omega-3 fatty acids begin to mildly inhibit the same CYP3A4 enzyme we just discussed, the one responsible for clearing atorvastatin from your body. Think of your liver's processing capacity like a lane on a highway. Atorvastatin uses that lane. At high fish oil doses, fish oil partially blocks the lane. Not fully, not as severely as grapefruit, but enough to extend the time atorvastatin remains at elevated levels in your bloodstream. The clinical effect is a modest increase in statin blood levels. Modest, but cumulative. Taken daily, over weeks and months, that accumulation compounds. Tonight, check the label on your fish oil. If your combined EPA and DHA total is above 2 grams per day, speak with your pharmacist about adjusting to a dose that supports your heart without this interaction. Before I continue, type the word 5 in the comments right now if you are currently taking atorvastatin alongside any supplement. I read every single response, and what you tell me shapes what I cover next. Immediately here, after the strongest content moment. If this is new information, if nobody walked you through this before, this channel is where I do exactly this. Every video. Hit subscribe and the notification bell so you do not miss what I publish next. Thing 4. Magnesium and calcium taken at the wrong time. Magnesium and calcium are commonly recommended for adults over 60. Bone health, muscle function, sleep quality. Entirely legitimate reasons to take them. The issue is timing. Atorvastatin, when taken alongside high-dose mineral supplements, can experience a reduction in bioavailability, meaning less of the medication reaches your bloodstream in active form. Polyvalent cations, that is the clinical term for high-concentration mineral ions, can bind to certain medications in the digestive tract before they are absorbed. Think of your digestive tract at absorption time like a narrow bridge. Atorvastatin needs to cross that bridge to reach your bloodstream. When high-dose calcium or magnesium is present at the same time, they crowd the bridge. Some of your medication does not make it across at full potency. The practical consequence? Your atorvastatin may be delivering less of its cholesterol-lowering effect than your prescription accounts for. Not because the medication is wrong, but because of when you are taking everything together. Tonight, separate atorvastatin from any calcium or magnesium supplement by at least 2 hours. Take your statin first, let it absorb, then take your minerals later in the day. 4 down, and the final one. This is the interaction that I want every person watching to remember, because it is the one most people do not suspect at all. It involves something that has been described as protective for your liver. Thing 5, milk thistle, and the mechanism that pushes atorvastatin higher. Milk thistle is taken by millions of adults specifically because they are on a medication they know is processed by the liver. The logic is understandable. If atorvastatin puts some burden on liver enzymes, why not protect the liver with a natural compound? The issue is that milk thistle's active compound, silymarin, inhibits the same family of liver enzymes responsible for metabolizing atorvastatin. Not as severely as grapefruit, but consistently and over time. Think of silymarin like a well-meaning shield placed over the machinery inside your liver. The intention is protection. The effect is that some of the machinery slows down, including the mechanism that clears atorvastatin. A review in the journal Drug Metabolism and Disposition documented that silymarin significantly inhibits multiple cytochrome pathways relevant to statin metabolism. The result is elevated atorvastatin blood levels, the same risk profile we described under the grapefruit interaction, arriving through a different door. What makes this particularly common is that some patients are told, or read, that milk thistle supports liver health while on statins. The science does not support that pairing at standard supplemental doses. Tonight, if milk thistle is in your supplement rotation, bring the bottle to your next pharmacist interaction and ask specifically how it affects your atorvastatin metabolism. I want to close the clinical section with 4 rules. These are not suggestions. These are the 4 behaviors that determine whether atorvastatin works the way it was designed to work. Rule 1. Your supplement list is part of your medication list. Treat it that way. Your pharmacist can cross-reference your full supplement regimen against your prescription in a single conversation. That conversation takes less than 10 minutes and can identify interactions your prescription label never addressed. Request a complete medication supplement review. Today, not at your next annual visit. Rule 2. Never add or remove a supplement while on atorvastatin without a pharmacist check first. A supplement that appeared safe 3 years ago may interact with a new prescription you added last month. Every addition, regardless of how natural it sounds, requires a review against your current medication list. Rule 3. Grapefruit is a permanent rule, not a preference. There is no safe dose of grapefruit while on atorvastatin. Not half a glass, not every other day. The interaction is not dose-dependent in a predictable way. It is enzyme-dependent, which means it varies by individual and accumulates with repeated exposure. Remove it from your diet entirely. Rule 4. If you develop muscle aches, heaviness, or unusual fatigue, name it to your doctor specifically as a potential statin interaction. Do not accept "it is your age" as a complete answer without a creatine kinase blood test, a simple marker that shows whether your muscle tissue is under strain. Dorothy's 14 months of unexplained pain had a measurable cause. Yours may too. I want to come back to Dorothy now, and I want to be honest about what this moment feels like when it happens in a real clinical conversation. Dorothy's doctor ordered a creatine kinase panel after her symptoms persisted for a second appointment. The number that came back was elevated. Not catastrophically, but elevated enough to name. The supplement she had been taking alongside her atorvastatin was red yeast rice, a product marketed as a natural cardiac support. She had been doubling her effective statin dose for 14 months without knowing it. Her doctor adjusted the protocol. The red yeast rice was discontinued. Her muscle symptoms resolved over the following 6 weeks. Dorothy told me something in a follow-up conversation that I think about often. She said, "I thought I was doing everything right. Turns out I was doing too much, just without the right information." That is what I want for you. Not less effort, not less care. The right information, so that the effort you are already putting in works the way you intended it to. You now have what Dorothy did not have when she first opened that bottle. I want you to picture what this actually changes. Not a lab number, not a chart. The moment you stand up from the kitchen table without bracing for the ache in your legs. The morning where the fatigue that has been sitting on you for months is simply less. The quiet confidence of knowing that the medication your doctor prescribed is doing exactly what it was designed to do, with nothing working against it in the background. That is the difference between a prescription and a complete picture. Tell me in the comments, which of these 5 interactions was new to you today? The red yeast rice, the grapefruit, the fish oil, the minerals, or the milk thistle? I read every single response personally, and what you share shapes the next video I make for this community. Share this with anyone in your life who is taking a statin and any kind of heart supplement. They are doing the right thing. They deserve the full information to go with it. You sharing this video may be the moment that changes what happens next for someone you love. In my next video, I am covering something that affects adults on blood pressure medication, a kitchen habit that millions of people have been told is heart healthy, that is doing something very different when combined with a common prescription. You will want to see that before tonight. This is Dr. Tiera Khan. Check your cabinet. Make that pharmacist call. I'll see you in the next one.